Thank you for joining me on the Save My Thyroid podcast, where I help people save their thyroid and regain their health. My name is Dr. Eric Osansky, and if you have hyperthyroidism, including Graves' disease or toxic multinodular goiter, then you will especially benefit from these episodes. If you have Hashimoto's thyroiditis, you also need to save your thyroid, and therefore you will also find many of the episodes to be valuable. You're about to listen to another Save My Thyroid audit, as I will spend 20 to 25 minutes chatting with someone who has a thyroid or autoimmune thyroid condition and give them actual advice to help them improve their health. In this Save My Thyroid Health audit, I will speak with someone who has hypothyroidism, who was taking Armour thyroid for 15 years and started experiencing hyperthyroid symptoms, and so she stopped taking it and then eventually started experiencing hypothyroid symptoms again. And her name is Kim. And although she hasn't officially been diagnosed with Hashimoto's, she did find me by reading my book, Hashimoto's Triggers. Just a reminder that this audit isn't exactly the same as a comprehensive consultation I do with a patient, as prior to doing an audit, I have the person fill out a brief application, and it's fine if they send a few basic blood tests, whereas with a patient consultation, I'll have them fill out a comprehensive health history and other forms, and they usually will also send a decent amount of labs for me to review. And of course, a patient consultation is a lot longer, but either way, I'm confident that you'll find this conversation to be valuable. Also, if you would like to apply to do an audit with me, you can do so by visiting savemythyroid.com/audit. As usual, make sure you listen to the post-episode chat after the outro music, as I'll expand on taking too much thyroid hormone replacement, testing for celiac disease, doing comprehensive blood testing, stress and Hashimoto's, and improving the health of your children and grandchildren. And you can access the show notes by visiting savemythyroid.com/186. Anyway, here's my conversation with Kim.
Welcome to the Save My Thyroid podcast, hosted by Dr. Eric Osansky. To stay up to date on the latest thyroid health-related topics, make sure to subscribe on your podcast player. And to get your free thyroid and immune health restoration action points checklist, visit SaveMyThyroidChecklist.com. The following discussion is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of this information without first speaking with your doctor. Now let's head to the show.
All right, so welcome to another Save My Thyroid Health Audit. I am here chatting with Kim. And so Kim has been dealing with Hashimoto's. And so start this conversation. So you've actually I should ask, you've been on Armour, or you were taking Armour for about 15 years for hypothyroidism and symptoms of Hashimoto's. Were you officially diagnosed with Hashimoto's? Did you have also the antibodies for Hashimoto's, Kim?
Not officially, no. That's something that my doctor wanted to explore once we decided if I was improving or not. I just have had the standard hypothyroid symptoms, and that's how I've always been treated.
Okay. And what are some of those symptoms that you've been experiencing over the years?
Well, initially it was cold hands and hair loss, basically. I had had pneumonia for a month, followed by bronchitis, and I've learned that thyroid problems can be initiated with a virus or something like that. And so it was in 2010 that I was diagnosed as having a hypothyroid, and things weren't working well. And I hadn't done any research or anything. It's like I just followed along. Oh, I need to take this medicine then.
Is that the only medicine, the only thyroid hormone replacement that you've been on, the Armour thyroid, or did you take a different, like the Levothyroxine is commonly given? Or
that's what they put me on at first. And then I started feeling like I had severe arthritis. I just had body aches all over. And then I started having muscle cramps. A friend suggested that I talk to my doctor about that. And so they switched me to Armour thyroid from there. And then all of that seemed to go away. I did add a little bit of iodoral. That seemed to be a good combination for a while.
Okay.
I just haven't felt well.
And then for those who are listening, iodoral is potassium iodide. How much did you take and how long did you take it for as far as the iodoral?
At first it was one pill, and I don't remember the dosage. It was your standard basic.
Yeah,
dosage.
typically 12.5 milligrams, I know, is like a full tablet typically.
Yeah.
So
Then I started cutting that in half just because I felt like it was too much. I started to feel like I had a balance there, but I went from, I think it was 90 milligrams of the Armour up to, it was 180 at this last point. And then that's when I started having those thyroid storm feelings and started doing a lot more research, trying to figure out what I was feeling. And things were starting to just pinpoint back to food allergies, too much medication. And so I started to just wean myself off carefully. Well, I thought it was carefully. I had a headache for a little bit, but then I started feeling really good the less medicine that I took. I would also take a thyroid supplement initially from theliverdoctor.com. She had a really good blend. She's a great resource. But then I also have found one out of Utah. Is that Zao, maybe? But it's a good blend of thyroid supplement. And so I'm taking that, and then this other raw dissected beef that I'm taking
Okay.
with some oils.
You said with some oils?
Yes, the MCT oil with the ADK drops and molecular progesterone. That's all I'm taking for that.
Okay. So the bovine desiccated thyroid supplements is what you're taking. And then you're taking 2 thyroid supplements, one from the liverdoctor.com and then the raw desiccated bovine from the other company?
I stopped with the liver doctor one. I substituted a different one. It has more of the vitamins and supplements that I was missing according to the research that I was doing. So I've got that, and then the bovine supplement. I take those.
And how long have you been off the Armour for?
Since September.
All right. And then also trying to be gluten-free, sugar-free, grain-free, dairy-free as well?
Gluten-free, yes. I'm working on the grain and dairy, kind of a milk diva with my coffee. I haven't gotten away from that, but I don't drink a whole lot of milk after that. And I stay away from most cheeses, maybe cottage cheese occasionally. But I've noticed that I have histamine reactions to those. I've learned about the histamine reactions. And so when I have that, then I stay away from it. Sugar is a big thing for me. Sugar and gluten. I have noticed tremendous histamine reactions from sugar. It's almost instantaneous. I have to reach for a Kleenex. It's pretty.
Wow.
And then with gluten, I'm starting to notice that if I have like a piece of pizza that has the dairy on it, I have a stomach ache. I don't feel good when I've had gluten. Had a pretzel when we were on vacation, like one of the big soft pretzels. I couldn't even get through the whole thing because I started to feel like I was falling asleep. I just had such a reaction to it. I also noticed that while being on the Armour thyroid with that thyroid storm, that it initiated like the type 2 diabetes symptoms. So my blood sugar just really spiked. And when I went off of the Armour and stayed off gluten and sugar at the same time, my blood sugar started to regulate. But it was more research that I had read about also indicated that sometimes can happen with that thyroid storm and type 2. It's strange.
All right. So you put your biggest health challenges, the hypothyroidism, the food sensitivities, which you kind of just touched upon, and then the symptoms of Hashimoto's. So your most recent TSH was 13, is that correct?
Yes.
Okay. And then you've gone through different programs, the Forefront Medicine program. And have you done any functional medicine testing, like besides blood tests? Have you done adrenal testing?
I'm trying to work through this first quarter to April when we redo my blood test. And then I was hoping to maybe find a functional medicine doctor here in Toledo.
Okay.
I've heard a couple of them that I might explore, see if that's a different way of dealing with something.
Yeah. Okay. Yeah. I mean, that's definitely I guess you could see how you do over the next few months with, like you said, the recommendations that have been given, and then retest the blood work and see what the blood work looks like. If the blood work is looking better and you're feeling better, then maybe just continue on that path. If not, then I would definitely look into doing some functional medicine testing. I mean, the first thing we want to see if you have Hashimoto's antibodies. Just most people with hypothyroidism have Hashimoto. So my guess is and it's not perfect. Like if you're negative, it doesn't 100% rule out Hashimoto's. Like if you do there's two main antibodies associated with Hashimoto's, TPO or thyroid peroxidase, and then thyroglobulin antibody. So you want to make sure to get both of those tested when you do get those tested. And then if one or both of those are elevated, along with an elevated TSH, that's typically diagnostic of Hashimoto's. And then with Hashimoto's, as I discuss in my book, Hashimoto's Triggers, I mean, just there's a lot of different triggers associated with Hashimoto's. There could be food. Yeah. Stress is a big one, chemicals. So again, what you're doing, like diet, lifestyle, supplementation, I mean, it's fine to see if that helps, because you definitely need to incorporate diet and lifestyle changes. But if you don't head in the right direction, if things are not improving, that's when I would definitely look into doing some type of functional medicine testing. And that sounds like a good idea, finding someone in the area I'm sure you'll be able to find someone within driving distance who practices functional medicine. If you have to work with someone remotely, you could do that too. But again, there's more and more functional medicine practitioners, again, especially those would focus on hypothyroidism and Hashimoto's, not as many that help people with Graves, but Hashimoto shouldn't be as challenging. So the TSH, I will say this about the TSH, TSH13, TSH is thyroid stimulating hormone. So it's a pituitary hormone that communicates with the thyroid gland to produce thyroid hormone. So it does sound like, you were taking too much thyroid hormone in September. Your TSH was on the lower side, it was 0.8. And so you were experiencing more hyper symptoms. But now what it's saying with that TSH of 13, it's now the opposite, where you're more on the hypo side and you're taking some thyroid support supplements like the desiccated bovine. I mean, I guess the question is, which you might not know, is if it includes thyroid hormone, because some of them do, some of them don't. Not all of them will tell you if it has any thyroid hormone. So it could have the glandular removing the thyroid hormone. But it does look like maybe you might benefit from some thyroid hormone, whether it's Armour. Again, I'm not giving specific recommendations because I don't prescribe thyroid hormone, but that's something where if things are not improving over the next few months, and let's say TSH still remains elevated, and especially if you get the antibodies tested, then let's say you ends up working with a functional medicine practitioner. Hey, this is Dr. Eric. And if you're looking to do everything you can to save your thyroid, in addition to listening to this podcast, there are a few different ways we can help you. First of all, I've written 3 books on thyroid health, 2 related to hyperthyroidism and 1 related to Hashimoto's, and you can get all of them on Amazon, or to learn more about them, visit savemythyroid.com/thyroid books. Second, you can also join my Graves' disease and Hashimoto's healing community by visiting savemythyroid.com/thyroid group. And finally, if you want to get personal help from me, you can visit the website workwithdreric.com. Just to let you know, I only see a limited number of new patients each month, and I do require anyone interested to complete a brief online application before working with me. And now back to the show. The goal, even besides the thyroid hormone, like I said, the goal is to try to remove the triggers, address the underlying cause. And then maybe if you do need to go on thyroid hormone in the future, again, maybe, and hopefully it's only temporary, just to help with the symptoms. And also the body does need thyroid hormone. You don't want it to get too low. But like I said, hopefully it would be on a temporary basis while your health is improving. And then when your immune system, because Hashimoto's is more of an immune system condition than a thyroid condition. So when you optimize your immune system health, you might not need thyroid hormone. Some people do. Some people, the damage to the thyroid gland is severe enough where they might need to keep taking thyroid hormone, even though there are other therapies like cold laser, red light that might help to heal the thyroid directly. So those are other things to look into if and when you work with another functional medicine practitioner. I guess, again, we want to be optimistic and hope after these few months that you do the testing. First of all, we want to hope that you feel better, that you're feeling better. And then when you do the testing, things at least are heading in the right direction. Maybe the TSH is not perfect, but maybe it's a lot lower and it looks like, hey, this might be helping. So maybe I need to just continue doing what I'm doing for a few extra months. But if not, a few months go by, you're still not feeling great. And the TSH, even if it's like 11, to me, that's not much of an improvement. And if it's higher, that's obviously not good. And it will fluctuate. So you don't want to just rely on TSH. You want to look at the thyroid hormones, the T3, the T4, see what those look like. And again, I mentioned the antibodies already. If it's determined where things are not improving and you need to see a functional medicine doctor, that's when they'll evaluate you and determine, well, do we need to look at the adrenals, the hormones, do some gut testing, look at nutrient deficiencies, and then give specific recommendations based on what's going on. I mean, there could be mold toxicity. I mean, a lot of things can go on. And it's not suggesting you would need to look into all of those, but
My doctor also he prescribed an ultrasound of my thyroid, and it did show that because of over medication, my thyroid has shrunken. Is that a reversible thing or is that a permanent thing usually?
typically it is reversible. You were taking the thyroid hormone for a long time. I mean, if someone's taking it for a while, the body does become dependent a little bit on the thyroid hormone, but usually something that can be reversed over time. I mean, another concern with taking too much thyroid hormone is the bone density. Like it could negatively affect bone density. So have you received any type of bone density test like DEXA or something? So
No.
that may be something to look into and just make sure, because that you could improve the bone density. If you have like osteopenia, osteoporosis, you could reverse that. It just takes time. And you probably need to do other things like weight bearing exercises. And the first thing is being aware of that. So the thyroid itself, everybody's different. So I'm not saying guaranteed it would go back 100% where it was, but you asked, is it possible? And it is. And like I said, there are now therapies that might help out. So when I work with someone with Hashimoto's, my goal is to focus initially on the immune system, the autoimmune component. But there's also now things like I mentioned, cold laser, red light therapy, things I can't do remotely. That's an advantage of working with someone in person who does those therapies. But the first thing you need to do if it is Hashimoto's is address the immune system, because if you don't address the immune system, then you'll still get damage taking place at the thyroid gland. Some would say you could do both at the same time, and it's not going to hurt to do both at the same time. But to me, it makes sense. Like if we're going to prioritize the immune system as the cause of the damage to the thyroid gland, the different question you asked, the too much thyroid hormone causing those changes, and now you're not taking the thyroid hormone at all. If you go back on the thyroid hormone, you obviously wouldn't be going back to the same dose, I would imagine, since that was too high. You'd have to adjust it. I mean, the body is very resilient. The thyroid does take longer to recover than other parts of the body, like the gut and the liver, but it doesn't mean that it can't heal and regenerate over time.
Okay. So many things to consider.
Yeah, so many things to consider. See, I would say just the main highlights to summarize to think about is to just see the next few months, ensure following some recommendations, taking some supplements, making dietary changes. Let's see how that goes. And then they'll do another blood test. And again, if things improve, great. Just stay on the same track, probably, if both symptom wise and blood test improve. So we want both of those, obviously. And then if not, then yeah, definitely I would look into the functional medicine testing. I think either way, it's a good idea to look at the antibodies for Hashimoto's, see if those are present too. But yeah, thank you again, Kim, for taking the time to do this audit. Hope you found this to be helpful, and definitely keep me posted. Feel free to give me an update in the future.
Absolutely. And I thank you for your resources because it's been helpful, very helpful.
Yeah, you are welcome. Thank you for reading or listening to them. Whether was it mainly like the podcast or what? I didn't ask you initially. How did you find me?
Well, just being a troll on either Facebook, but then one research person leads to the next research person. And it's just like this rabbit trail. And then I got your book, The Hashimoto Triggers, and I've listened to a couple of the podcasts. And so as I have time, I continue to read and research and read and research. So,
Well,
yeah.
wonderful. Well, cool. Well, yeah, thank you for getting my book. And I'm glad you found it helpful. And the same thing with listening to some of the podcast episodes. And I mean, you're doing a lot of great things. I mean, avoiding gluten, minimizing dairy and the sugar. So, I mean, keep up the good work with that. And again, hopefully you get some good changes. And if not, there's still hope. It's not, we all want the quick and easy fix, but many times it does take some time. So let's cross our fingers and hope maybe it will be quicker in your case. But if not, like I said, I definitely wouldn't give up hope. It just means you have to dig deeper, do some more detective work, probably with those functional medicine tests.
Sounds good. Thank you.
All right. Thank you. Thanks again, Kim.
You're welcome.
Thank you for listening to the Save My Thyroid podcast. If you haven't done so already, make sure you hit subscribe to stay up to date on the latest thyroid health-related topics. And to get your free thyroid and immune health restoration action points checklist, visit SaveMyThyroidChecklist.com. Thanks so much for tuning in.
All right. So that was an excellent conversation with Kim. So once again, Kim was taking Armour thyroid for quite a while and eventually became hyperthyroid. And so she stopped taking it abruptly. And her TSH months later was 13, which again is hypo. And I mean, with a TSH that high, maybe the best choice is for her to take thyroid hormone again at a lower dose. But she seems set on following the current protocol for a few months. And so we'll see how she does. Again, she's not working with me, but she'll maybe email me and give me an update. Just curious to see how she's doing or how she does after following the protocol. And essentially just taking supplements, which I'll get to in a minute. But before talking about that, she also asked about testing for celiac disease or was thinking about testing for celiac disease, which I think is a good idea. If someone is, now you have to be consuming gluten to test for celiac disease. If you've been gluten-free for definitely a few months, even in some cases a few weeks, then you're not going to produce the antibodies. And even if you are positive, you would get a false negative. Celiac disease is more common in those with Graves and Hashimoto. So it makes sense for her to test for it, especially since she has discomfort when eating gluten. I mean, either way, she would want to avoid gluten just because she's symptomatic, but still would be nice to find out if she has celiac disease, because she has celiac disease and she really wants to be careful. And if she doesn't have celiac disease, again, she probably still wants to avoid gluten, but maybe doesn't have to be as careful, like when it comes to cross-contamination, for example. Okay, so blood testing. She did blood testing, like if it was a regular consultation with a patient, they probably would have sent me the blood test that they would have had previously, but I didn't look at any blood tests other than she did include some on the form she filled out, the application to do the health audit. She could have sent some basic blood tests. If she sent like dozens of pages, I wouldn't have gone through all that because, again, that's the goal of a regular consultation. But it sounds like, though, that she is pretty much taking the supplements based on whatever blood testing she's had. And I like to do functional medicine tests to find the causes, underlying imbalances. I mean, doing comprehensive blood testing, which I do that as well, we might find a vitamin D deficiency and have the person take vitamin D. And there might be some other imbalances, iron deficiency, homocysteine could be elevated, and maybe they need some folate and or B12. So the blood testing can be helpful, but I always go beyond the blood testing. So stress and Hashimoto. So she mentioned she has high stress. Stress definitely can be a factor with autoimmune conditions, Graves' disease as well. When I dealt with Graves, stress was a big factor. And again, not just emotional stress, overtraining, over-exercising. You're not going to eliminate the stressors, but just doing things to improve stress management, to improve stress handling skills. And then she also mentioned how she also wants to help her children not get, well, again, we don't know if she has Hashimoto's, but good chance she does. But either way, she wants to prevent her children from going through what she's going through. And that's also a benefit of taking a natural approach and addressing the cause of the problem. If you have children or grandchildren, or both children and grandchildren, then you could educate them. You could educate your children, and then hopefully they'll educate their children, your grandchildren. But yeah, if you have children, you want the very best for them. And so if you're dealing with Graves or Hashimoto's or a non-autoimmune thyroid condition, but especially Hashimoto's or Graves, since there is a genetic component, and there is a chance that if you have children, that one or more of them might develop thyroid autoimmunity. So you want to educate them about eating whole, healthy foods, minimizing or avoiding gluten, maybe even testing them for celiac disease if you have celiac disease, because again, there's that genetic component with celiac disease as well. And the importance of stress management and getting sufficient sleep and reducing their toxic burden. When it comes to my health and restoring my health from Graves, obviously I get to educate so many other people who have thyroid and autoimmune thyroid conditions, but also I do have 2 daughters, and over the years I've educated them. And I mean, they're definitely not perfect with the diet and the sleep and stress management, but I'd like to think that they're a lot better than they would have been if they didn't get educated by me. So again, that's a benefit too, that you could pass the knowledge that you learn from not just this podcast and my books, but other resources out there. And so that's all I wanted to chat about here. As usual, I hope you found this episode to be valuable. Hope you enjoyed the conversation I had with Kim. And of course, I look forward to catching you in the next episode.